Hey, good afternoon, everybody, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. As a reminder, this is for press only, so if you are not a member of the press, please log out and watch on one of our live streams, which include the Department of Public Health's Twitter and Facebook accounts, phila.gov/PHLGovTV, Comcast Channel 64, or Verizon Channel 40. We'll begin our briefing with opening remarks from Mayor Kenny. Mayor, you have the floor.
Thanks, Lauren. Good afternoon, everyone. As we've seen for nearly a year, the impact of COVID-19 is not just a public health crisis, but an economic crisis as well. In Philadelphia, small businesses have been hit incredibly hard by the pandemic. On Friday, we announced the new Philadelphia COVID-19 restaurant and gym relief program to support those hard-hit industries. We estimate that these grant awards will be in the range of $5,000 to $15,000 per business. The application for the program opens this Thursday, January 28th at 11 a.m. It can be found at phila.gov/RGRP. That's phila.gov/RGRP. The form is simple and will take no more than 15 minutes to complete. If approved, businesses may use the funds as needed to continue operating, including rent or payroll. Investments in outdoor winterization improvements to indoor ventilation and other COVID-related physical space expenses or PPE purchases are also encouraged. Since announcing the program at the end of last week, we have been coordinating with our partner organizations, including BIDS, CDCs, and community business partners, to do education and outreach to ensure broad awareness of the program. The Commerce Department is also available to assist business owners in filling out the application. This includes language assistance, technological assistance, and more. Businesses should contact the Commerce Department's business service team at business@phila.gov if they need help. That's business@phila.gov. Though the city continues to support businesses to the best of our abilities, I also want to remind folks that the federal PPP program remains the most significant source of relief funding at this time. We strongly encourage businesses to apply regardless of whether or not they received a loan from the program last year, since there are changes to the latest round of PPP that can help small business. The Commerce Department team can also help you with PPP if you contact them at the email address I mentioned a minute ago, business@phila.gov. I want to thank all the businesses that have gone above and beyond to do their part in stopping the spread of the virus. We appreciate you and sincerely hope we can get back to normal soon. Now to Dr. Farley for his update.
Thank you very much, Mayor. Our COVID case counts are falling, and we are providing vaccine, but slowly due to the limited number of doses we have. I'll give you the background on that, but first the numbers. Since this time yesterday, we've identified 568 new cases of the coronavirus infection in Philadelphia residents confirmed by the PCR test, bringing us to a total of 104,484 cases since the beginning of the epidemic. And in addition, there are 118 new probable cases diagnosed by the rapid antigen test. Now, for the past week, January 17th through the 23rd, we averaged 401 cases per day. That's both the PCR test and the antigen test. That's so far. We expect more to come in later. And of those people tested, 6.7% were testing positive. Put that in perspective, for the previous week, January 10th through the 16th, we averaged 518 cases per day, and 6.7% of the tests were positive. Now, that decrease in cases we're seeing is in the context of pretty substantial declines in cases all around us. Pennsylvania, New Jersey, and the United States as a whole are all seeing about a 30% decline in the past 2 weeks. But still, our case counts are very high because case counts were very high before that decline occurred, so we still need to take precautions. On deaths, we have 26 newly identified deaths from the coronavirus infection, bringing us to a total of 2,821 since the beginning of the epidemic. Now, we peaked at a little more than 100 deaths per week for the weeks of December 13th through the end of December. But for the week of January 3rd, we were at 85 deaths. Week of January 10th, 61 deaths so far. Expect those numbers to rise somewhat, but I do expect that this is a decline, and I believe that decline is tied into the decline in the overall case counts. Now let me move on to vaccination. Overall, we're making progress, but we still have to manage the problem of a low number of doses and a very large number of people who are eager to be vaccinated. Dr. Carolyn Johnson, the Deputy Commissioner for the Health Department, will be discussing in a minute how we're making vaccine available. But I'd like to first just take a couple of steps back and comment on where we are overall. Because here at the Health Department, we're getting lots of calls and emails. We know this is a very frustrating period for people. It's frustrating for everyone. We've been virtually locked in our homes for the past 10 months, stuck alone or in front of a computer screen instead of spending time with the people we want to be around. And for those 10 months, we all have just wanted to get things back to normal. And the vaccine offers now genuine hope that things will get back to normal. Now that the vaccine then has arrived, many of us desperately want to get that vaccine immediately. Hundreds of thousands of people in Philadelphia now want to get the vaccine. Now, as health commissioner, I'm very excited that so many people want to be vaccinated. But we only have 20,000 doses per week. If you run those numbers, you can make it clear that it'll take months to give everyone a chance to be vaccinated who wants to be vaccinated. So that waiting and the uncertainty, not even knowing when you'll be able to get the vaccine, is just making things seem so much worse for everyone right now. So I understand that. I understand this is really tough for people. I wish I could fix that. I wish I could give everyone vaccine today, or even give a schedule so that everyone knows when he or she will get it. But because we don't know how many doses we'll get in the future, we can't put out a schedule like that. What I can say is they're working extremely hard to make the vaccine that we are getting available as quickly as possible. First to the people that would enable us to save the most lives, and later to everyone else. And that because people are wearing masks, and because we are vaccinating people, every day we are one day closer to being back to normal. So I simply ask for your patience for this long journey back. Now let me just turn to our safer at home restrictions. As you know, on January 16th, we backed off cautiously on our restrictions. We allowed indoor dining to begin in restaurants with a maximum seating capacity of 25%. It's only been 10 days since then, so it's too early to see whether there's an effective backing off on those restrictions. We are at the same time now allowing high school sports to resume with careful restrictions that we've worked out with the coaches. Most important, for high school sports, people need to be wearing masks 100% of the time, including during games. And high school athletics will have an oversight to ensure that those rules are followed. We still have prohibitions on high-risk indoor sports for community leagues. And we will continue to not allow indoor catered events and indoor social gatherings of any size, because those are the primary way the virus is spreading right now between households. So what should people do right now? Well, unfortunately, as I went through just a minute ago, the vaccine will not help us get through this winter wave. We simply don't have enough doses for us to have an impact with this vaccination on the epidemic right now. So we needed to use the tools we already have. That means no indoor gatherings, no parties, no inviting friends and relatives over, no sleepovers for the kids. And plan now, I have to say this, no indoor Super Bowl watch parties. Those could be just as dangerous as Thanksgiving. Do get together with others, do it outside with masks. And these are the same precautions, even if you've already been vaccinated. For more information on all of our guidance is on our website, www.phila.gov/COVID. With that, now I want to turn it over to Dr. Johnson to talk about our vaccination work.
Dr. Johnson, you're unmuted. You can go ahead.
Okay. Good afternoon, everybody. I'd like to give you some detailed information about the distribution program so far. As of today, we have received 132,000 doses of COVID-19 vaccine in Philadelphia. We have given 90,600 first doses of vaccine and 24,600 second doses of vaccine. These doses have all been administered in Philadelphia and have been reported to our immunization information system. We have also visited 45 of 47 long-term care facilities in Philadelphia and have offered vaccine to patients and staff in those sites through a partnership with some local pharmacies. The remaining 2 sites are scheduled to be visited in the next week. In addition, vaccines are being administered through all hospitals, federally qualified health centers, district health centers, and 26 pharmacies across the city. We'll be expanding to add several new pharmacy sites in the next week. And when the long-term care facility project closes out in the middle of in the middle of February, we will be transitioning those pharmacies over to providing vaccine to the public as well. The number of vaccine doses allocated to Philadelphia remains very limited, as the commissioner just mentioned. We receive approximately 20,000 doses per week, and that is the quantity we expect to receive weekly through the end of February. The vaccines that we're receiving continue to be Pfizer and Moderna products. We get about 50% allocated for each one of those. And these are both mRNA vaccines. No serious adverse events or complications have been reported to the health department after those 90,000 plus administrations. The vaccines were shown to be highly safe in clinical trials, which is now borne out by our own experiences in giving the vaccine within Philadelphia. Philadelphia is in the phase of immunizing persons in priority groups 1A and 1B right now. This includes healthcare workers, long-term care residents and staff, essential workforce, persons living and working in congregate settings, persons 75 years of age and older, and persons with certain high-risk medical conditions. There are a large number of people in the eligibility group of 1B, so it's going to take several months for us to work through all of those individuals. This week, as part of phase 1B, we started immunizing some of our first responders, including police department and fire department personnel. Protecting this particular workforce is imperative for ensuring both public health and security, as well as community well-being. It's another step in the right direction to returning our city to normalcy. Finally, I want to encourage everyone who is eligible for COVID-19 vaccine through phases 1A, 1B, or 1C to register on the city's new portal. It's phila.gov/vaccine interests. This website allows you to indicate your interest in being vaccinated and identifies what your eligibility criteria is. People who register on the website will be notified when a vaccination opportunity for their eligibility opens. So far, we have more than 130,000 people registered through this portal, and we're going to use it as one of our main ways to communicate vaccine availability to select groups. Thank you.
Thank you, Dr. Johnson. Now we'll have Armando deliver a summary of these remarks in Spanish, and then we'll move to Q&A. Armando, you can take it away.
Palabras del alcalde Jim Kenney para el 26 de enero del 2021. Buenas tardes a todos. Como hemos visto durante casi un año, el impacto del COVID-19 no es solo una crisis de salud pública, es también una crisis económica. El viernes pasado anunciamos el programa de ayuda para los restaurantes y gimnasios afectados por la pandemia, para brindarles alivio como uno de los sectores más afectados por las restricciones del mes de noviembre. Estimamos que estas subvenciones estarán en el rango de $5,000 a $15,000 por empresa. La manera de hacerlo es presentando solicitudes para este programa que se abre este jueves 28 de enero a partir de las 11 de la mañana. Las empresas pueden solicitar su ayuda en phila.gov/RGRP, es decir, phila.gov/RGRP. El formulario es muy simple y no le llevará más de 15 minutos completarlo. Si se aprueba la solicitud, las empresas pueden usar los fondos según crean necesario para continuar operando, incluso para el pago de su alquiler o su nómina de empleados. También se recomienda usar los fondos para acondicionar los espacios para poder dar servicio al aire libre durante el invierno, para mejorar la ventilación y para comprar artículos de protección personal y para otros gastos relacionados con el COVID-19. El Departamento de Comercio está disponible para ayudar a los propietarios de negocios a completar esta solicitud. Este apoyo incluye servicios de traducción, asistencia tecnológica y mucho más. Las empresas que requieran ayuda pueden acudir al programa del equipo de servicios comerciales del Departamento de Comercio en business@phila.gov, es decir, business@phila.gov. Aunque la ciudad continúa apoyando a las empresas de la mejor manera posible, También quiero recordarles que el Programa Federal de Protección de Cheques de Pago sigue siendo la fuente más importante de financiamiento de nuestra ayuda en este momento. Como nota final, quiero agradecerles a todas las empresas que han hecho todo lo posible para ayudarnos a detener la propagación de este virus. Esperamos poder volver a la normalidad muy pronto. Gracias. Y esta es la actualización en materia de salud para el día 26 de enero del 2021. El conteo de casos va disminuyendo, felizmente. Estamos proporcionando la vacuna lentamente debido a que contamos con dosis limitadas. Y vamos a comenzar con los números para el día de hoy. Tenemos 568 nuevos casos confirmados por la prueba PCR. El total acumulado confirmado es de 104.484 casos. Se ha identificado 118 casos probables por la prueba rápida de antígenos. La semana pasada, del 17 al 23 de enero, el promedio fue de 401 casos por día y el 6,7% de pruebas resultaron positivas. La semana previa, del 10 al 16 de enero, el promedio había sido de 518 casos por día, con un 6,7% de pruebas positivas. Estamos viendo disminuciones en Pensilvania, en New Jersey y en los Estados Unidos en general. Sin embargo, el número de casos sigue siendo alto y necesitamos todavía seguir con nuestras precauciones. Con respecto a las muertes, tenemos 26 identificadas el día de hoy, con un total de 2.821 muertes por el COVID-19. Esperamos más debido a la demora en los informes que nos llegan. Con respecto a la vacunación, estamos avanzando, pero aún tenemos que gestionar los siguientes problemas: un bajo número de dosis para administrar y una gran cantidad de personas interesadas en vacunarse. Debido a que en el Departamento de Salud recibimos llamadas y correos electrónicos, sabemos que este es un periodo profundamente frustrante para muchos. Estuvimos prácticamente encerrados en nuestras casas por 10 meses y solamente queríamos volver a la normalidad. Y sabemos que la vacuna nos ofrece una esperanza genuina para que las cosas puedan volver a la normalidad. Así que finalmente llegó la vacuna que muchos de nosotros queremos. Queremos recibirla desesperadamente de inmediato, pero solamente hemos recibido 20.000 dosis por semana. Si seguimos recibiendo este número de dosis, se necesitarán varios meses para que todos en Filadelfia tengan la oportunidad de vacunarse. Ojalá nosotros pudiéramos mejorar esto. Ojalá pudieran ser vacunados todos el día de hoy, o incluso que pudiéramos darles un cronograma para saber cuándo se recibirá la vacuna. Pero debido a que no sabemos cuántas vacunas vamos a recibir en el futuro, no podemos establecer fechas firmes. Así es que les pido paciencia en esta nueva etapa. En cuanto a las restricciones del programa Más Seguro en Casa, el 16 de enero nosotros emitimos un relajamiento con cautela de muchas de las restricciones existentes. Permitimos el servicio en el interior de restaurantes con un 25% de ocupación aprobada. Han pasado ya 10 días desde que lo hicimos y es aún demasiado pronto para ver el efecto. Sin embargo, también permitimos que se reanudaran los deportes en las escuelas secundarias con cuidadosas restricciones. Lo más importante ha sido de que las máscaras deben usarse al 100% en interiores, incluso durante los juegos. Supervisamos los programas de atletismo de las secundarias para garantizar que se sigan estas reglas. Y sigue habiendo prohibiciones en las ligas comunitarias de deportes que se practican bajo techo, porque éstas representan un nivel de riesgo elevado. Seguirán restringidos, por lo tanto, los eventos en espacios bajo techo, las reuniones sociales en interiores de cualquier tipo. Hemos descubierto de que estas son las principales formas de propagación del virus entre los hogares. ¿Qué es lo que deben hacer los ciudadanos de Filadelfia mientras tanto? Primero, saber y entender que la vacuna no nos ayudará a superar esta ola de invierno, que estamos recibiendo dosis insuficientes para administrarlas a todos. Así que, por favor, todavía necesitamos usar las herramientas que teníamos a nuestra disposición. No se permite reuniones en interiores de ninguna naturaleza, ni fiestas de cumpleaños, ni pijamadas, ni reuniones de amigos, o simplemente fiestas para ver el Supertazón o el Super Bowl en casa. Queremos ser enfáticos. Esto puede ser tan peligroso como fueron las reuniones por el Día de Acción de Gracias. Así que, por favor, si se junta con personas que no sean miembros de su hogar, hágalo al aire libre y utilice mascarillas todo el tiempo. Y si ya está vacunado, debe seguir con estas observaciones de igual manera y continuar usando su mascarilla. Y esta es la actualización sobre el proceso de vacunación que nos ha proporcionado la doctora Caroline Johnson. Hasta la mañana de hoy se han recibido 132,000 dosis de vacunas en Filadelfia. Se han administrado un total de 90,574 vacunas y el porcentaje de administración es del 69%. Se visitaron 45 de los 47 centros de vacunación a largo plazo de Filadelfia y se les ofreció la vacuna a los pacientes y al personal en estos sitios a través de una asociación con las farmacias locales. En Filadelfia, las vacunas contra el COVID-19 están siendo administradas en los centros de salud calificados a nivel federal, en los centros de salud municipales y en 26 farmacias. El número de dosis de vacunas asignadas a la ciudad sigue siendo limitado. Estamos recibiendo aproximadamente 20,000 dosis por semana y esperamos seguir recibiendo esta cantidad hasta finales de febrero. Los estudios clínicos nos han demostrado de que estas vacunas que estamos recibiendo de los laboratorios Pfizer y Moderna son altamente seguras, por lo que ahora se confirma en nuestras propias experiencias. Después de vacunar a más de 90,000 personas en Filadelfia, no se han reportado reacciones adversas o complicaciones a nuestro departamento de salud. Y actualmente, Filadelfia está inmunizando a las personas en los grupos prioritarios 1A y 1B. Estos grupos incluyen a los trabajadores de la salud, a los residentes y el personal de cuidado a largo plazo, a los trabajadores esenciales y a personas que viven y trabajan en entornos congregados, a las personas mayores de 75 años y a aquellos con ciertas afecciones médicas de alto riesgo. Hay una gran cantidad de personas elegibles en la fase 1B, así que tomará algún tiempo finalizar esta fase. Esta semana, como parte de la fase 1B, comenzamos a vacunar al personal de primera respuesta, incluyendo los oficiales del Departamento de Policía y del Departamento de Bomberos. La protección de esta fuerza laboral en particular es imperativa para garantizar la salud y la seguridad pública, así como para el bienestar de la comunidad. Este es un paso más en la dirección correcta para retomar la normalidad en nuestra ciudad. Finalmente, quiero alentar a todos los que son elegibles para recibir la vacuna COVID-19 durante las fases 1A, 1B o 1C a que se registren en el portal de la ciudad. Esto es phila.gov/vaccine interest. Es decir, phila.gov/vaccine interest. Este sitio web le permite indicar su interés en vacunarse y permite identificar cuáles son sus criterios de elegibilidad. Las personas que se registren en el sitio web serán notificadas cuando se abra una oportunidad de vacunación de acuerdo a su elegibilidad. Juntos seguiremos ganando esta lucha. Muchas gracias.
Thank you, Armando. We will now move to Q&A for members of the press. In addition to Mayor Kenny, Dr. Farley, and Dr. Johnson, we are also joined by Managing Director Tumar Alexander. And today, Commerce Director Michael Rashid and Deputy Commerce Director Karen Fegley are also available to answer any questions you may have about the new restaurant and gym relief program. As usual, only one representative from each outlet will be permitted to ask questions during each round, and we ask that reporters limit their questions to 3 or fewer in the interest of time. We'll be limiting the first round of questions just to the topic of COVID-19, so if you have questions regarding other topics, please hold those for a second round if time permits. If you'd like to ask a COVID-related question, please use the raise your hand function listed under participants. We will unmute your microphone when it's your turn. So today we will get started with Mitch Blocker from NBC 10. Mitch, you should be able to unmute yourself and ask your question.
Thank you. Good afternoon, everybody. Dr. Farley, Mr. Mayor, I'm not sure who might be best for these questions, but I wanted to ask about your relationship with Philly fighting COVID and your partners around testing and vaccinating. Dr. Farley, can you explain how the city vetted Philly fighting COVID before partnering with them?
Simply say they were an organization that was providing testing for us, and they were under contract for us to provide testing. And then when vaccination first became available, they offered to do that and said that they could run mass clinics. They completed a provider agreement based on their ability to do testing and our need at that time to get an awful lot of unaffiliated healthcare providers vaccinated in a hurry. We decided to give them the opportunity to run mass clinics. And the first mass clinic went quite well with the number of people who were vaccinated. So there was none of the problems that have come to light now had come to light at that point.
Does the city have a contract or any agreement with that group that prevents it from selling or sharing private information?
The city has a contract with them for testing that does have agreements about the use of the data for that. But there was no contract for this. There was no money exchange for them to run this clinic. This was done on a voluntary basis.
And my understanding is you provided them with almost 7,000 vaccine doses, and some of that, about 193, is unaccounted for. Where could those doses have gone, and what are you doing to find them?
I don't know about those specific numbers. I'll have to look into that. We have the ability to, we know how many doses we give an organization. We get reports of each dose that's reported that's given back to us. But you know that there is a difference between 5 and 6 doses to a vial. And so a small fraction of that we can't always account for. I saw earlier today a claim in a tweet that the organization might have diverted some doses. If that's true, that's very disturbing. They shouldn't do that. As you know, we've stopped our relationship with this organization, but we're going to try to do what we can to find out if there were any missing doses. And as I said, that we will not be working with that organization in the future.
Is your backgrounding for your partners adequate, in your opinion?
Well, obviously in retrospect, this organization wasn't good for us to have a partnership with that organization. And we'll see what sort of additional things we might do to check up on any organization working with us at this time.
Thank you, sir.
Thank you, Mitch. Next up, we have David Melanger from Philly Sports Network. David, you should be able to unmute yourself.
I just have two quick ones for Dr. Farley. First off, you mentioned about the high school sports restrictions. Can you just go over them one more time?
Yeah, the key is that everybody needs to wear masks all the time. And so the big issue really was around high school basketball. There are many students that want to get back to playing high school basketball. And we know that basketball indoors is a high-risk activity. There's been outbreaks in the NBA, outbreaks in college, and they don't wear masks. And so we insisted that they wear masks. And so we worked it out with the coaches about a variety of mechanisms to enforce mask use for those teams. In addition to that, there's no spectators, no tournaments, limits on the number of people involved, and other precautions that you might see elsewhere.
So I just want to make sure I understand. So you're asking the high school basketball players to wear masks during the game as they're actually playing it, or just on the bench?
During the game, when they're actually playing the game, yes.
Okay, and my last one would be over the weekend, the Michigan Health Department came down and put a pause on all sports on the University of Michigan because some of the athletes called it the variant from the UK strain that's going on right now. Have you been in talks with any of the other city schools, in particular the Division I schools here in Philadelphia, about any potential shutdown?
Not specific to that. We have reviewed and approved specific safety plans for all of the sports teams that are active in the colleges. That's something we thought we want to be quite safe with. And so they're tested every day, the active players. Now that test doesn't tell us whether it's the UK variant or other variants. And certainly there have been cases. But we have, I feel like a pretty strong safety plan for those college sports.
All right, thank you.
Okay, thank you, David. Next up, we have Maggie Kent from 6ABC. Maggie, you should be able to unmute and ask your question.
Sure. Hi, everybody. Again, this is for Dr. Farley in terms of Philly fighting COVID. I know there's people who are concerned that their data has been breached, and there's also people that are concerned that they won't be able to get that second vaccination that they were hoping for, especially this week, since there will be no more vaccines that are distributed to Philly fighting COVID. How should people get in touch with the health department if they don't hear from you first? And where will these vaccines now be going? Will there be a new clinic set up by Philadelphia itself, or will you be continuing partnerships, let's say, with the Black Doctors Consortium? How will you get all of these people vaccinated for their second dose?
Right. So the first message is we will assure that everybody who got their first dose of Philly fighting COVID gets their second dose. We will run a clinic or multiple clinics in order to match them for the times that they're due for their second dose. We'll either run that by ourselves at the health department, and we have ways of doing that, or run that with another partner organization. We're still working that out. But everybody knows we will make sure that they have that second dose opportunity. And everyone should know that we have that information. When people were vaccinated, that information goes into our database. So we know exactly who was vaccinated when, and we know to communicate with them about exactly what the second dose opportunity is.
And what was the last straw? Why did the city decide to cut ties with this organization? What was the red flag that popped up that said, okay, this is not right? And there's allegations that they would be profiting from distributing vaccines or from handing out people's personal data. What do you know about that? Where was the profit coming from?
Yeah, so what came to light when an Inquirer reporter asked this question yesterday was, they had gone from nonprofit to for-profit status, and then they had information in their, I guess, incorporation documents that said that they would have the ability to sell the information from the website. And we did not think that was appropriate. We thought this, if there's any attempt to do this, even the possibility, then people won't trust this organization. We didn't feel at that point this was truly a trustworthy organization. Up until that time, they had vaccinated a lot of people, and so there was a lot of good that came out of that. But we thought that having a trustworthy organization was very important. And so that's when we stopped at that point. As far as the names, now the organization is saying that they have no intention of selling that information. They haven't done that yet. We're working with our law department to see if there's any way to make sure that that doesn't happen. But right now, they're saying that there has been no use of that information like that.
And then, again, you talk about trust. This is a major concern for thousands of people who signed up on this website first before the Philadelphia website was ever established. They gave all of their information out. We talked about the need of building trust, establishing trust within the community, and then the trust is completely broken, and Philadelphians are concerned that their local government is partnering with people who they don't know.
Yeah. So I can understand why people would be concerned about that. And this is, in retrospect, we should have been more careful with this organization. I hope people, though, try to understand that at the time, we had a fairly large number of doses that arrived at once. We had a lot of people we wanted to vaccinate quickly. And here we had an organization that we had worked with that looked like it had the capability of doing that, and in fact, did do that. So I hope people can understand why it is, on the surface, this looked like a good thing. Nonetheless, I do understand why people are upset with that. We were very upset as well. That's why we've terminated the relationship.
Thank you.
Thank you, Maggie. Next up, we have Max Marin from Billy Penn and WHYY. Max, you can go ahead and unmute to ask the questions you have.
Hi, thanks so much. Dr. Farley, Philly Fighting COVID had leftover vaccines available at the convention center on Saturday. Were you aware that there were leftover vaccines after they had turned away people with confirmed appointments, including many elderly Philadelphians? And were you aware that anyone was leaving the site with them?
I don't know any of the facts you're talking about. I have to run down those facts. In general, the way that these clinics operate is if they have leftover vaccine at the end of the day, it's returned to us. And so I'll have to find out if there's anything that would happen that was inappropriate about doses at the end of the day there.
Okay, you've said repeatedly that Philly Fighting COVID's for-profit status and this issue with their terms of service was the disqualifying factor. Did you or anyone on your team have any other allegations that you were looking into regarding the group beyond this?
I was concerned about the story that they had abruptly stopped testing. And so that was in the backdrop as well. But that was the information that was available to me when we made the decision.
So nothing about unlicensed staffers who were providing vaccines or anything about vaccine administration issues?
I had not heard of any complaints about that, no.
Okay. Last question for Dr. Caroline Johnson. Are the teachers who teach in Philly schools but live outside the city able to get vaccinated in phase 1B? And if not, will that create a delay in vaccinating all the Philadelphia school teachers? Or Dr. Farley?
Yes, thanks for the question. Yes, we are going to take responsibility for vaccinating all teachers regardless of what their residence is. And we will be partnering with one of the universities in the city to handle the teacher vaccination program.
All right, thanks so much.
Thank you, Max. Thank you, Dr. Johnson. Next up, we're going to go to Laura McChrystal at the Inquirer. Laura, you should be able to unmute.
Hi, thanks. A question for Dr. Farley. What is a timeline for, reestablishing a partnership with a group in place of Philly Fighting COVID that can provide vaccines?
You know, I'm not going to sure I'm going to give you a timeline, but I really just want to reassure people we absolutely will run the clinics when they're due. So if people had to be, say, 4 weeks between doses, then at 4 weeks we will be there providing doses, whether it's our own staff or whether it's another organization, for example, a healthcare provider in the city. We haven't settled yet. I imagine sometime in the next few days. Can't give you exact time, but the main thing is we assure that we'll be there to do that.
Okay, and what type of group would be able to or is going to be able to provide vaccines at that same level and speed that Philly Fighting COVID had been doing?
You know, it could be the health department leading this, and then the people who vaccinate are nurses. There are lots of volunteer nurses or contract nurses that we can bring in to provide the vaccination. And then other people are staffers who collect information or they do traffic flow. We can get those staffers from several sources as well. So either we could staff it ourselves or we could have, for example, a hospital that we work with that has run their own mass clinics for their own healthcare providers run this operation.
Okay, and lastly, we had heard from a number of readers who fall into the category of being over 75 or having certain health conditions. And there seemed to be a lot of confusion on, you know, whether they should go to their doctor or their hospital. Have hospitals started giving out vaccines to those patients who fit that category?
Yes, hospitals have started giving out vaccines to patients who fit that category. But remember, there's over 90,000 people who are over 75 combined, right? We're getting 20,000 doses a week. So even the group over 75 may well not be notified for weeks from their hospital. But I'd say that the first place that people should go to if their provider is affiliated with one of the large health systems is to talk to their provider about getting vaccination in that health system. If they don't think that, if they don't have a provider or they're not sure that it's going to work, then they can go to our vaccine interest site and put in their information, and we'll notify them of opportunities.
Thank you.
Thank you, Laura. Next up, we have Mike Donofrio at the Philadelphia Tribune. Mike, you should be able to unmute and ask your question.
All right. I guess this is for Dr. Farley. You said a few weeks ago that the administration tasked hospitals with finding solutions to closing the racial gap among those who are getting the vaccines. So I ran the numbers on the city website, and it looks like 12.3% of all the tests have gone to African Americans, a number that has really not changed over the last few weeks. So can you provide some sort of update? What have those hospitals put in place, and why aren't they making any progress?
Well, you know, the vaccines that are being administered in our website are not just hospitals at this point. They're much beyond that. Okay. You know, I can assure you the hospitals are working on that. I can't give you numbers on hospitals specifically about any changes in that. But I do know they're working on that. I don't know, Dr. Johnson, if she can give any more detail on that work.
I think one of the ways that we're trying to address this is by making sure that clinics that are located in the areas where persons of color live and work are supplied with vaccines. So we have preferentially placed vaccine with the federally qualified health centers and with our own district health centers. And their outreach to patients and uptake has been well represented among persons of color. So I expect that we're going to see improvement in the racial breakdown of vaccination in the coming weeks.
All right. And then what are, I guess, back to Dr. Farley, or, what are the long-term effects of African Americans in the city getting vaccinated at such low levels? And sounds like you already asked this other part. So yeah, what are the long-term effects, I suppose? Well, you know, the point I tried to make earlier is that we have so few doses that the large majority of people in Philadelphia are unvaccinated right now. And so we're going to have to get through this epidemic wave with the other protections. The vaccine is only going to be helping us some months in the future. We hope that we're going to catch up and have other racial groups represented more in the vaccination as we get farther down the line. But people shouldn't think right now that the vaccination is going to change the overall epidemic. We vaccinated approximately 7% of the adult population in the city right now, simply the few number of doses we have. It means 93% are unprotected, and that's going to be, the
large majority across any racial group.
Maybe just lastly, what does this just vaccine racial gap say about the city's vaccine rollout? I mean, many people I've spoken to have said that they're not really surprised at these numbers, but, considering what the administration was touting going in, I remember speaking to you weeks ago saying, I know the availability is done on an equitable basis, but the numbers are what the numbers are, and African Americans still are not represented, very highly. So, what does maybe this gap say about the city's vaccine rollout to this point?
We are definitely concerned about the low administrations in African Americans and other minority groups. We want that to be higher. We will be doing more community outreach to try to address people's legitimate concerns about the safety of the vaccine. But we didn't think it was really appropriate to be running a media campaign right now that says, please try to get your vaccine when it's so difficult for people to get vaccines. The number of doses is small. So we're going to be working on that over time, but we're concerned about it.
Thanks.
Thank you, Mike. Next up, we have Martin Pratt, Philly YBN. Martin, you can go ahead and unmute.
Hi, Dr. Farley. I have a question about, sorry, I'm not on camera. I have a question about the vaccination schedule. I just got a reader that was trying to find out, they're a frontline worker, and they're trying to find out their coworker has got the vaccination. They're an older person, so they're 1B, and they feel like they have to be vaccinated with their coworker because they're in a tight space, enclosed space every day.
Hola Armando, buenas tardes. La primera pregunta es si hubo algún contrato con Philly Fighting COVID en cuanto a la administración de vacunas por parte de ellos. Si es que sí, ¿se puede explicar cuáles fueron las directrices establecidas en cuanto a la información personal de personas y cuántas dosis se le proveyó a esta organización?
The question is probably for Mayor. Was there a contract signed with Philly Fighting COVID? If so, can you explain what the guidelines were regarding people's personal information and how many doses were provided to PFC?
As Dr. Farley already answered the question, there was a contract with them for testing. There were requirements in that particular contract that personal information not be released. Because we were trying to get as many people vaccinated as possible, we continued that relationship on the vaccine side. They were doing a reasonably good job on the vaccinations. They decided apparently that they were going to monetize some of this information, which was wrong. And we terminated our relationship with them. The reporter for the Inquirer brought it to our attention. We investigated it. It was true, and they're gone. And that's the end of them.
Como lo ha dicho el Dr. Farley, nosotros teníamos un contrato con esa organización para la administración de las pruebas que requería que no liberaran la información protegida, pero como nosotros continuamos esa relación y nos dimos cuenta de que ellos tomaron una decisión de monetizar esa información, lo cual encontramos que es algo malo e incorrecto, nosotros decidimos terminar esa relación.
¿Se sabe cuántas dosis se les proveyó a esta organización? No sé si el Dr. Farley pueda...
Dr. Farley, would you know how many doses were provided to PFC?
The doses were provided according to how many patients they had scheduled, how many people had scheduled to be vaccinated. And then doses that were unused in those clinics were returned back to the health department. I don't remember the total number. I know in the first weekend, they did 2 days, and they vaccinated some 2,500 people. And they probably had another couple of clinics beyond that.
Se les dio el número de dosis en relación al número de pacientes que estaban programados para inmunizarse y se supone que tendrían que devolver las que no se han utilizado. No recuerdo exactamente la cifra exacta, pero la primera semana se inmunizó alrededor de 2.500 personas y los días subsiguientes un número similar.
Listo, y Armando, ¿cómo la ciudad o el Departamento de Salud piensa proveer la segunda dosis a personas que fueron vacunadas por esta organización y a las personas que se registraron para recibir la primera dosis? ¿Cómo se van a asegurar de que esto ocurra?
The question is, how will the city provide a second dose to those that were vaccinated by PFC and to those that registered with them but did not receive the vaccine? How will the city ensure that they get their second dose?
Anybody who was vaccinated by them, we have that information in our database, and we will contact those people and let them know about the follow-up clinic for them to receive their second doses. So people can be assured if they got their vaccine, they will be contacted by us.
Todas las personas que recibieron la primera dosis con ellos están incluidos en una base de datos a la cual nosotros vamos a utilizar para contactarlos para que ellos reciban su segunda dosis.
¿Y se sabe si la organización vendió información personal que recolectaron y qué va a pasar con la información que ellos ya tienen recolectada?
Do you know if PFC sold the personal information that it collected? And if that's the case, and what will happen with that information now?
You'll have to, Philly Fighting COVID is saying that they have not sold that information and they're not going to sell that information. That's good if that's the case. We'll talk to our law department and see if there's anything that could be done. But right now they're saying that they're not going to sell that information.
La organización PFC nos ha dicho que no han vendido nada de la información que ellos han recolectado. Nosotros vamos a ver con nuestro departamento legal que nos indican las pautas, pero ellos nos han indicado que no van a venderla ni la han vendido todavía.
Thank you. Next up, we're going to go to Kelly Rule at Fox 29. Kelly, you should be able to unmute to ask your questions.
I just wanted to clarify something. So Philly Fighting COVID is claiming that they did inform the city that they changed to a for-profit model, but is it the city's stance that they were never made aware of that?
We were made aware of that after they made the change. And you know, a for-profit organization by itself would not necessarily be disqualifying. And we work with other organizations like Rite Aid that's a for-profit organization. But the combination of that change and then this language that implied that they might be selling the information was, and in the context of this continuation of the testing, was we thought that was simply made them not a trustworthy organization.
Okay. And I know you kind of addressed this, Dr. Farley, but at a time where there's just, you know, so many frustrations and a lot of confusion with the number of vaccines and being able to get one, what kind of disruption does something like this cause for city residents?
Well, I'm sure it's very disturbing for people because so many people want the vaccine right now and we have so few doses. And so anything that looks like a glitch in the distribution process is going to be even more frustrating for people. I understand that. It will not overall slow down our vaccination process, though. We have other organizations that can provide these doses. Our limit is not on the number of people who can give injections. Our limit is the number of doses we have.
Thank you.
Thank you, Kelly. Next up, I have Johan Calhoun from Chalkbeat. Johan, you can go ahead and unmute.
Thank you. I think teachers are concerned that even though the city would like to see schools to reopen, teachers are not at the top of the priority for subgroup 1B to get the vaccine shots. Is the timestamp still there for them to have to wait weeks until they get the vaccine?
Like I said, teachers are amongst the many people who want to get the vaccine and are not yet getting it right yet because we have so few doses. I would certainly say we're going to be weeks away from vaccinated teachers. I can't say how many it's going to be. It depends on how many people in the other priority groups are interested in getting vaccination. Let me point out that people who are in contact with very vulnerable people, for example, someone who works in a nursing home, they are particularly important to be vaccinated because if they get infected, they might pass it on to someone who would die from the infection. Teachers are very important because we can help get the schools open if the teachers are vaccinated, but they're not in contact with those sort of vulnerable people, like someone who works in a nursing home. So while we very much want to have them be vaccinated, there's many other groups as well that can make a strong case for why they should be vaccinated now.
And the school district is planning on rolling out the opening of school from the lower grades up. So the kindergarten, first grade, second grade individual is less likely to have it or transmit it. So it's not as critical as someone teaching at a university level or working in a nursing home.
Okay, and with that said, Mayor Kinney and Dr. Farley, it sounds as if you are perfectly fine for the school district to go ahead and start reopening schools for pre-K and second grade. And the reason why I asked that is taking a look at the numbers for parochial and private schools. With so many schools that are in session right now, they've only seen 9 outbreaks. So, are you pushing for the district to hurry up and reopen the schools? So what's your thinking there?
We want to get the schools back open as soon as possible. And the lower grades are the less exposed. And they're also the citizens of our city who are losing the most ground by not being in school. The earlier years of the child's education is some of the most important years. And these kids are almost a year behind now where they would be in their matriculation. So we want to make sure at the end of their educational process that they're educated and equipped for the future and for work. We have to get them back in school. Every year we lose with a small child is even more exacerbated than a kid in high school.
Was that it, Johan?
Well, yeah, just a quick follow-up question. And what would be the biggest concern? You brought up the economy, and some other people have been concerned about learning loss. But what's the biggest concern here in not reopening the schools?
Our kids are falling behind educationally, especially in the early years. That's why we did the beverage tax to pay for pre-K. We wanted to get pre-K up and running because it gives the kids a head start in their educational continuum. And if we obstruct or have an obstruction in that process in kindergarten, first grade, second grade, they're actually losing more ground than they would be at a higher level.
Excellent. Thank you.
Thank you, Mayor. Thank you, Johan. Next up, I have Pat Loeb at KYW. I know she was having some issues with the raise your hand button. Pat, you should still be able to unmute and ask your question.
Thanks. Dr. Johnson, can you say which university you're working with to vaccinate teachers?
I can't yet because we're going through a formal vetting process for that particular institution. So
okay.
It'd be best to hold off.
And Dr. Farley has said it's weeks away. Do you have any more specific timeline, even once it gets rolling, how long it would take?
Well, so our understanding is that the workforce that needs to be vaccinated is probably around 20,000. And we have to weigh that against finishing up a police force of almost 7,000, a fire department workforce, corrections officer. So there are a lot of groups that we have to get through vaccinating before we can start with the teachers. And so we have to make sure that we have 20,000 doses available. Now, we don't expect to do all of that in a single week. I think that there will be some spreading this out over time.
And remember, the angst and all of this started in the last presidential administration where they had no plan at all. And the reason we're scrambling now, like we scrambled to get PPE back in April and May, is because they had no plan for PPE. So now we find out we're getting 20,000 doses a week when we could have been getting 3 or 4 times that amount if they had a plan. Thank God they're gone. The Biden administration, Harris administration are developing that plan after being shut out of a transition process until almost the day they were sworn in out of spite has put us where we are. So, all those folks sitting in cars in Florida and other places waiting and riding around Florida looking for a vaccine, they can thank the last president.
Thank you, Mayor. That's it for me.
Thank you, Pat. Before I go to the next person, I did just want to note we are running short on time and I still have 3 folks left to ask questions. So we are going to go to Charlene Santiago at Univision, followed by Stephanie Stahl at CBS, and then finally Jad Slayman at WHYY. So Charlene, you can go ahead and unmute to ask your questions. Yes, and then finally Jad Slayman.
Hello.
You're good, Charlene.
Hi. Yeah, sorry. Quería preguntar brevemente, se le está recomendando a los residentes a matricularse e inscribirse en el portal de Internet. ¿Hay alguna actualización para aquellos residentes que no tengan el acceso a hacer lo mismo por Internet?
My question has to deal with a recommendation for residents to sign up through the website on the Internet, and if there's any update for those residents who do not have access to the Internet in order to register.
Doctors?
Well, I can make a comment about, I know that the website requires one contact information, so you may put in your email and or your phone number. So we are aware that some people don't have email and don't use it. And for people who do not give us an email, we will be making contact through the telephone number that they list. From the standpoint of how do you register on that portal if you do not have any access to technology, we're working with some of our partners, such as the Philadelphia Corporation for the Aging. We're going to talk to about how we can assist people in registering online. And I think there are a number of agencies who have helplines to assist seniors in doing that. So that's our strategy for addressing that problem.
Para las personas que no cuentan con una cuenta de correo electrónico, les estamos dando la opción de que puedan incluir su teléfono y nosotros les contactaremos por teléfono para lograr su vacunación cuando se dé este proceso. En cuanto a las personas que no cuentan con acceso a la tecnología siquiera para poder registrarse, nosotros tenemos socios comunitarios como el Philadelphia Corporation for the Aging, que les están ayudando a las personas a poder hacer el registro electrónico, para poder hacerlo en línea. Y nosotros estamos explorando otras opciones para expandir este acceso para las personas que no tienen acceso tecnológico. Gracias.
Listo. Y brevemente, ¿cuándo fue la última vez que Philly Fighting COVID logró administrar las vacunas? Que me confirmen la fecha y cuáles son los planes con el centro de convención.
My next and final question is, when was the last date in which Philly Fighting COVID was able to administer doses of the vaccine? And what's the latest on the program at the convention center?
I'm not close enough to give you exact date as when the most recent clinic that they ran some number of days ago. And as I said before, we'll make sure that everybody who was given their first dose by that organization gets a second dose. Likely it'll be at the same place, but we will follow up with those people who were vaccinated.
No le puedo dar una fecha exacta de cuándo fue que detuvieron su operación. Sé que ha sido unos días atrás, pero sí les podemos asegurar de parte de la ciudad que aquellas personas que recibieron su primera dosis van a recibir su segunda dosis. Es muy probable que no sea en el mismo lugar, pero nosotros los vamos a contactar para que sí las reciban. Gracias.
Perfecto. Muchísimas gracias.
Thank you, Charlene. Next up, we'll have Stephanie Stahl at CBS 3 and then close it out with Jad from WHYY. Stephanie, you can go ahead.
Hi, yes, I still want to get some more clarity, if possible, on this vetting process with Philly Fighting COVID. The group describes itself as a bunch of college kids wanting to help out. So why was it ever a good idea to enter into a partnership with this group and entrust them with thousands of doses of vaccine?
No, this was an organization that had provided testing services for us. They were under contract with us. They did provide testing. And they were, worked with our staff and presented a plan for how they could vaccinate people at a time when we needed to work quickly to get a number of healthcare workers vaccinated. In the beginning, we got a lot of doses at once to vaccinate healthcare workers. We had to get a lot of home health aides, low-income workers who are unaffiliated with hospitals vaccinated quickly. So we had that history with them for the testing services. They had what looked like a good plan. We looked and saw we had staff there at the initial site, and the vaccination worked well. We got 2,500 people vaccinated in 2 days. And so it looked at that time like this was a success. This other information came to light subsequently.
Thank you.
Thank you, Stephanie. And then finally, we will go to Jad Slayman at WHYY.
Hello. My question is for Dr. Farley. I see now that the city is looking at distribution proposals from Penn, from Temple, these big well-known organizations. And today you're talking about working with Philly Fighting COVID because you needed to get these vaccines out very quickly. All of a sudden, you had this big demand. But of course, we knew the vaccines were coming for months and months and months in advance. We know the phase trials. It was common knowledge that we'd have a vaccine likely by the end of the year. So my question is, why didn't you use these many months to go to Penn, to go to Temple, to go to these reputable powerhouse medical outfits that we have in the city and set this up way in advance instead of looking at these college kids and saying, you know, good enough? It seems like you guys are throwing Philly Fighting COVID under the bus a bit, and rightly so, but somebody in the city government looked at all these options we have in the city with plenty of time before a vaccine showed up and said, nah, Philly Fighting COVID is good enough. Who made that decision and why?
Let me just say the vaccines were only approved for use around December 14th, and then the very next day they started shipping them. And so while we had plans in place, and every health department in the country had to come up with plans, there was a lot of uncertainty as to when the vaccines would arrive, which vaccines would be approved, and what populations they would be approved for. Would they be approved for people over the age of 65 or not? So there's a tremendous amount of uncertainty. The second thing is that when the first doses came in, they were designated for healthcare workers. The hospitals were very busy in getting their own staff vaccinated during that time, and so that they were not enthusiastic about suddenly going off to another site and vaccinating the unaffiliated healthcare workers. We want to get these healthcare workers vaccinated quickly. And so, it was, again, based on the history we had, it seemed like a reasonable step at the time. Again, in retrospect, we wish we had worked with that organization, but we did get an awful lot of people vaccinated in a short period of time there.
But so were you surprised that a vaccine got approved in December? I mean, it seems like you should have been prepared for that, and that we know all the phase trials of these vaccine candidates, that it's not unreasonable to assume that you have to be ready to distribute a vaccine at the end of the year.
But which vaccine it was, what the restrictions would be for that vaccine, which populations it would be recommended for, were all unknown at that time. Even the Advisory Committee on Immunization Practices, it met after the vaccine was approved to say what populations it was to be delivered to. And so all that had to be decided really very quickly at the end.
In retrospect, do you wish you would have partnered with one of these organizations in the months that you had before this expected vaccine approval at the end of the year?
Well, in retrospect, I wish we hadn't worked with Philly Fighting COVID. I said that. I'm not sure if we had gone to these other organizations and said, during a time when you're vaccinating thousands of your own staff, can you also do this other operation for us? Whether they would have said yes.
Oh, you don't. But did you ask, or did you just expect that they wouldn't have been able to?
I did not ask. I'm not sure whether my staff asked.
Thanks.
All right, thank you. We are out of time for today, but if anyone still has questions, as always, you can send them to press@phila.gov, and we will see you back here next week. Thank you, everyone.